Good day, and a very warm welcome to all of you who are joining our webinar this morning, or this evening, or whatever time it is around the globe. I am Timmons, CEO of Global Healthcare Accreditation for Medical Travel Services, or GHA as we are commonly known. GHA is a specialized accreditor of medical travel services and programs. We complement national and international clinical accreditors by doing a deep dive into the entire medical travel care continuum, including pre-arrival and post-discharge. Our emphasis is on the patient experience, as well as sustainable business practices and care management practices impacting medical travel patients and programs. A few weeks ago, GHA was fortunate to speak to 4 hospital leaders of medical travel programs from around the globe. And tonight, we are starting our second series that involves 3 ambulatory centers on 3 continents who will share their strategies for managing through the COVID-19 crisis. Our first guest in this series is Dr. Erik Fleischman, former Chief Medical Officer of Bumrungrad International Hospital and currently the Executive Director at Bangkok Anti-Aging Center in Thailand. We welcome you, Dr. Fleischman, and he is uniquely qualified to speak on this topic, having joined the fight against AIDS in one of South California's largest private HIV/AIDS treatment practices following his specialty training in oncology. He participated also in the early studies and development of antiretroviral medications and treatment preventions for deadly infections. Additionally, in 2014, Dr. Fleischman joined the fight against the Ebola epidemic as Assistant Medical Director and Director of Training for 4 rural-funded Ebola treatment units in remote Liberia. So we are very privileged to welcome Dr. Fleischman and his expertise today. To start with, Dr. Fleischman, can you share how today's challenges regarding COVID-19 might differ from those that you have experienced when working and battling against HIV/AIDS and the Ebola crises?
Well, hey, Karen. First of all, thanks for asking me to be on. You're really one of the people I respect most in the international world of medicine, and it really is an honor to work with GHA. I've always enjoyed working with them. Now that that's out of the way, you know, every epidemic. This is really my fourth and a half epidemic, and each of them are different. You know, I was thinking about it today. Every time you go through one of them, you go, wow, this is over. I really hope this never happens again. And then something comes back that's a little bit different. So the difference in the epidemics that I've been involved in, and that being HIV starting in 1991, and then Ebola 2014. I was also around for H1N1 and H5N1, and I've been through plenty of dengue and malaria epidemics as well. You know, they all have similar characteristics in affecting marginalized people, except for COVID-19. Now, I think this is why the world's having such a big problem with it. Now, when I was over working with Ebola, you know, the world was behind us, but it was still really separated, and people were going, well, that's only Africa, right? A lot of people have their feelings, well, that's Africa, and this is where we test medicines, and this is a poor continent, and this could happen to them. But COVID has really shocked the world because it's not selecting out marginalized populations. It's affecting everybody. And I think that's the reason why we're having so much massive panic going on right now. And unfortunately, a lot of that panic is obfuscating the most important messages that we need to keep for trying to control this virus, you know, in a very practical way. So yeah, this one is different because it's all over the world. It's all over the world in a time where media is so big that it's made it even bigger than it is.
Yes.
Right,
Yes.
because remember, SARS was killing a lot more people, quite honestly. SARS was everywhere. If we had the same media now when SARS was around, it would be even bigger. Yeah. So, you know, we're trying to give people information and give them practical things they can use so they can feel like they have some control over their situation instead of just waiting to be a victim of COVID-19.
Yeah, thank you. Well, it's been interesting to see how different countries have applied different strategies and tactics in mitigating the risk of COVID-19. And I wonder if you could share with us what Thailand, as well as your clinic, Bangkok Anti-Aging Clinic, what strategy have you put in place?
Sure. Well, it's interesting because I have clinics now in Bangkok, and I also am the medical director for Fortio, American Anti-Aging Clinic in Ho Chi Minh City too. That's more, Bangkok Anti-Aging's been around for 7-8 years. I just joined them about a little over a year ago. Fortio has just opened up less than 2 years ago. So there's two kind of drastic, they're drastic but similar in the way they're handling it. Now, Thailand has been kind of slow to put the population on lockdown. In the beginning, when there was a block on a lot of Chinese travelers coming from Wuhan, that was during Chinese New Year, and Thailand did not put a block on it because that's the #1 tourist season here. That's how Thai people make their money. So the government at first did not put much of a block on it. The cases started rising, and now the travel bans are in place. All the stores are closed, restaurants are closed. People aren't supposed to be out on the street in crowds. So it's a standard operating procedure that everybody else is doing. Are people respecting this lockdown? For the most part, although as time goes on, I see more and more traffic building day to day in Bangkok. So I think people are getting a little too comfortable with it. Now, on the other hand, in Vietnam, that lockdown went like bam. Don't come out on the street, close your business. My business there was closed almost a month now. The mall was closed, and people were told, do not be out in public with more than 2 people or you're going to get arrested. And people have really behaved themselves in Vietnam, and the case numbers are super low. Although that also depends on the amount of testing that you're capable of doing. So it's 2 very different strategies. Now in Thailand, our cases are down into the low double digits. I think yesterday was 30-something cases.
Oh, that is.
Yeah, and the deaths have not been huge here. I think it's up to 40, 43, maybe something like that since it started, and about 2,500 cases total. Vietnam's cases are way lower than that. Once again, you have to kind of take this in the spirit that the government is giving it as well, because you have to ride that line between making people feel good and still providing good public health and not tanking your own economy. Right. But, it's definitely going to be under control here a lot faster than it's going to be in the United States.
Yeah, it does seem like that. And even today, we had a major, is checking about people getting tired of the lockdown. You might have seen, we had a major demonstration in Michigan where 10,000 cars showed up and said, too many restrictions. So it'll be interesting as time goes on. But we know that, these challenges also bring opportunities, and certainly forcing healthcare providers to look at new, innovative, or creative ways to communicate, to reach out to both their current prospective patients, and certainly in medical travel. Now you also have the fear potentially lasting a longer period for international travel. So obviously there might be opportunities for webinars or podcasts or different ways to reach and communicate with patients. And maybe you could share some of the ways that you've been doing that with.
Sure. Well, one of the ways it did it, it was kind of by accident. I'm in private, I'm involved in 2 very successful private clinics, but I have a public health heart. Okay. I worked for the Clinton Foundation for almost 10 years doing HIV training all over the world, and I worked for Family Health International. I worked for a bunch of charities. I worked for Operation Smile. I think it's a great way to give back. So I felt that having had the experience that I had, that I was in a unique position to try to educate people here so things get better. And my office at Bangkok Anti-Aging Center and at Fortio Clinic kind of gave me a platform where I could reach out to people and give them the advice that I thought was most important for them. You know, when I look in the media, I think people are getting confused. I mean, we look at it as medical professionals. You look at it as somebody who's done JCI before. So everything we do is procedure and protocol, right?
Mm-hmm.
We do procedure and protocol because it makes us feel better and it makes the result happen that we're looking for. The lay people, they have no idea what's going on. They're getting messages. Use chloroquine, don't use chloroquine, stay inside, don't stay inside, wear a mask, don't wear a mask. So I'm trying to give out simple directives that everybody's going to understand. You know, not going into the chemical makeup of chloroquine or how azithromycin works, but simple things. Why should you wear a mask? Well, a mask is going to do two things. It's going to protect people from you, but it's also going to keep you from touching your face. You know what I mean? It gives people another level of confidence. Very simple messages like that. And fortunately, those messages were picked up here and people noticed and they put me on Thai public TV. And,
really?
And through a number of newspaper articles and Facebook Live and things like that, the messages have been getting out and I'm very happy with the uptake. And it seems people are happy, you know, at the end of all this, people are going to have to go back to their lives and feel comfortable with it. And I'm trying to help people look to that point and the best way to get to that point. And even more importantly, if they do get infected, what can they do so that they don't get a severe form of the virus? And you know, I think as long as you focus on that message with people, then people are going to appreciate what you're doing and they're going to get educated. You know, the good part about it is it's also made my clinic quite famous right now because they know good information is coming from it.
Oh, that's great. Well, besides newspapers or TV, are you using any social media or any other social channels?
Yeah, well, social media, our Facebook Live, Facebook videos. I try to do a video at least every 2 days. I do them from the office. I do them from my home. I just want to keep getting it out there that we're here so people, I mean, it's really good for the business, but it's also really good that people have consistency in messaging, right? If you tell somebody something once, people are going to forget it. If you keep repeating the message, then they're going to start to feel better about what they're doing.
Right. You're building confidence then and trust with patients and people as well. Do you have intermediaries that you need to reach out to as well, government entities or insurers? I'm not sure the clinic has those types of arrangements or if it's self-pay, so it might not be pertinent to your clinic. But are you reaching out to insurers or employers and other types of stakeholders? Or is it strictly the patients at this point?
We're not reaching out to them directly, but you know, I'm still a foreigner in this country, and I'm a guest. And I've been a guest in this country for 16 years. That's a long time to be a guest. But I also very much respect the Thai government. I mean, look, Thailand is a medical tourism hub, maybe the biggest medical tourism hub in the world, as you know, because the medical care here is actually quite good. And the experts that they have are actually quite educated. They're as good. They're Western trained. And they have good management of it. You know, it's not like some of our surrounding countries, like Cambodia, like Laos, like Myanmar. Now they would lack this kind of expertise in the government, and they should be reaching out to foreign experts. But Thailand has fantastic domestic doctors here who are smart, who are motivated, who are proactive, and they're advising the government very well. So if I can be of any support to them, I'm happy to. Do they need me to? Probably not. You know, but it's, so that's the way it is with the government. As far as insurers and things like that, not so much. I think right now our message is to go to the people.
Okay, no, I think that's very helpful. And I certainly understand it in your circumstance. One area that I think has been fascinating to see has been the significance that telehealth or telemedicine has had on healthcare systems during this pandemic, whether or not it's in helping to diagnose the virus from a distance while protecting both the provider and the patient, or in providing greater access to those who need care, where their primary care physicians or dentists might be closed down, or they cannot go out during this challenging time. I even heard a really astounding figure that Teladoc, a major provider of telemedicine, reported last month an increase of 50% in 1 week. Just 1 week, 15,000 visits requested in one day, with some analysts predicting that visits will top 200 million in 2020, when all of 2019 saw just 36 million. So maybe you could share with us your experience with telemedicine. I know you also have been working with that, and whether or not you think it will influence medical travel in the coming years, or healthcare in general in the coming years as well.
Well, it's interesting you mentioned Teladoc, because I work for them also. I work for about 5 or 6 companies. It depends on the day. I put a different hat on and do it. But I got involved with Teladoc almost a year ago, just to do consults and do second opinions, because they have a fantastic second opinion service, international second opinion service, where somebody in another country can get a second opinion from a Western expert. It's fantastic. It gives people a lot of confidence. Once COVID came in, I started working more regular for them and taking calls. And you cannot believe the number of calls that are coming in. Now, probably about 50% of the calls are coming in from people who believe they were exposed to or have COVID, or their children have it, or their grandmother have it. So a lot of the calls are about calming down the fear in people. Yeah. People say, I got the sniffles and I don't feel right today. And then, well, do you have a fever? Well, are you coughing? Well, are you having body aches? Are you having the major symptoms? And like I said, fortunately, in most cases, they don't have it. But then there's cases that do have to be managed online. Mm-hmm. And then it's a whole different directive of what they do. Do they go to the hospital? Do they not go to the hospital? Is this a mild case? Should you stay home? Should you avoid other people? But the point is that telehealth now is the safest way to get your medical information, as long as it's done in the right context. Now, you can't diagnose a hernia. You can't diagnose an appendicitis. You can't diagnose a heart attack. Last night I had a woman call in who had a miscarriage a while ago, was still bleeding. Same thing. We're not going to manage that. We are going to send that to the hospital right away. So as long as you follow the rules and the parameters with telemedicine, there is so much you can do with it. And like I said, the biggest goal here is to save people the concern of going to any hospital right now where they're going to run into COVID. So yes, Teladoc, also at the point where the stock market in the U.S. was crashing, Teladoc went up 30%. So the uptake from it is huge. Now the uptake, people think, well, it's a bunch of individual people calling in, but Teladoc and telehealth works for all the insurance companies: Cigna, Aetna, AXA, Bupa, GeoBlue. They all contract telehealth to do calls to their clients. So it's massive right now, and I think it's fantastic. I'm very, very proud to work with Teladoc, because if you saw the way that they ramped up in a time period where nobody else in the world had to ramp up their business, they did a fantastic job at it to make sure we had enough doctors and that the logistics were good. And more importantly, the communication between client and insurer and doctor, to be able to bring that up in a period of weeks was it shows a lot of skill and effort on their part.
Absolutely. So you see that organizations probably will be able to leverage this type of mechanism for increased use in medical travel, not post-pandemic cycle. We might be able to do more second opinions and things like that through telemedicine. Yes.
I think they'd be crazy not to. And this is something, when I was I worked at, as you know, I was a medical director at Bumrungrad for about 3 years. And I was trying very, very hard to push this during that time, because, your connection with your international clients is really important. And if they have a surgery and they go home and they think they're not going to see you for 3 months, they feel disconnected. And they don't feel like they're getting the information that they need.
Right.
So this is something that that I think is really important. I do hope that I know they have some telemedicine right now. I do hope it's being maximized. For my own clients, in Vietnam, we are going to start the service, not just to learn about regenerative medicine, but also to ask their questions about COVID, you know, and make their fears better. And by doing that, I think if anybody does this with their own private clinic, they are then going to be known to the public as somebody who is involved in CSR, who is showing themselves as a leader in the scientific community, and somebody who wants to reach out during a bad time and really show their presence. So it's a win-win for everybody.
No, thank you, Dr. Fleischman, for that. I guess looking at where we'll be in a few years, we know from history that post-SARS, post-MERS, post-swine flu, that medical travel came back, even though there was a period of time when obviously it was very significantly impacted, as it is today, like many other industries. I'm a strong believer, though, that the trends that spurred the significant growth in medical travel over the past decade, the need for more affordable care, more accessible care, more timely care, or higher quality care, will even be stronger in the post-world, given some of the economic challenges I think that patients and their families will be facing, as well as countries. But I wonder, you know, there's a pro and a con to this. I wonder, do you share that belief? How do you see the future for medical travel once we're over this, you know, immediate hurdle, the pandemic?
Well, Karen, I mean, you've forgotten more about medical tourism than most people will ever know in their lives. So I always defer to you in these matters. But I think it's going to come back the same way it did after every epidemic. People are still going to need medical tourism and medical travel. In some respects, you know, if you go back to 2015, people didn't know this, but if you remember, there was a time at Samsung Hospital in Korea. Remember, there was a case of MERS there. Yes. That unfortunately sat in their ER for 3 days in a row, created 100 cases in Samsung Hospital, spread out to the rest of South Korea, closed the country down for 2 months and cost $10 billion, right? That's something people forget right now because it's a new epidemic. So 2 points with that. Number one, people forget, and they will forget about this too and resume their travel. Number two, during that time, we also had a case come to Bumrungrad of MERS. A man who had come from the Gulf showed up in the ER, and our infectious disease doctor, a guy named Dr. Wichai, who's a very, very smart man, recognized it, isolated the man, and he may have saved the country from a huge financial collapse by doing so. So my point is that these lessons learned will go on towards improving the medical care that Thailand already has, because our infectious disease surveillance will only get better after this. Our ability to look for things before they happen, our practices that may have been slack up until now will improve. You know, we were all getting pretty fat, happy, and complacent in 2019. The economy was good, patients are coming in, everything's wonderful. I think this is a very good reminder that you must stay vigilant and run your hospitals and run your clinics with the protocols that things like JCI and GHA and all the other groups keep hammering into our heads. You know, we hate filling out the forms and going through it and everything, but things like epidemics remind you that without these, you cannot run your system during times where you don't have epidemics. And I think that's the lesson I hope everybody gets.
Yeah, well, I really appreciate your sharing your insights and perspectives and the many lessons learned over your distinguished career, certainly with infectious diseases. And we appreciate your taking the time today to share that with us. I'm sure the audience will appreciate that as well. So again, my regards and deep appreciation and thank you for all you're doing, Dr. Fleischman, in Thailand and throughout the world, really, and helping people cope and mitigate this threat. We appreciate it. And to our listeners, we certainly thank you for joining us. And we also care about you. I know you're going through a tough time. We're in this together. And please continue to join us on our series as we go to the second and third part in the coming week. Thank you again, Dr. Fleischman.
Okay, Karen, I just want to throw out a little advertisement here, and it's not for me. To the places that have not got GHA yet, this is more than one big reason why they should already. I noticed that a lot of what GHA did at Bumrungrad was looking at the safety of international patients, definitely as much as JCI did. And these are the kind of things that will keep a business going during a hard time and prevent you from going into a worse time and keeping your facility protected. So, Karen, as you know, I'm always a big fan of the organizations you work for. So thanks again for doing
Aging clinic, but thank you very much for that. I appreciate it. Have a good day.
All right.